excellent. Well, good morning, everyone, and welcome to the meeting of the Autism Spectrum Advisory Board. Appreciate everybody being here. We only gave a few weeks' notice for the meeting, but we felt it was important to get together this summer because once fall comes, right after Labor Day, everybody seems to be really busy, and we haven't touched base in a while as a group. So when Greg actually said, do you think you want to get together soon? I said, great suggestion. A lot of things have transpired, and it would be good to touch base. So thank you all for being here. Really appreciate everybody's time and dedication to this board. We have a great agenda today. We're going to get an update from Greg on some of the things that have happened legislatively recently, and then a presentation from Diane Hank on the important work that we've been doing on trying to better reach underserved populations. And then we want to discuss what other things we think we should be doing. The good news that I wanted to share is I think you've all participated and seen the report that we issued in May, which is, I think, a great document and helps show all the hard work that has been put into this by numerous people around this table, so thank you for that. So before we get into the agenda and moving, why don't we go around with introductions in the room so that everybody knows each other. And why don't we start with you, Greg, and we'll go around that way.
Thank you, Chairperson Burke. Greg Roberts, Director of Legislative and Intergovernmental Affairs for the New York State Office for People with Developmental Disabilities.
Neil Mitchell, Division of Enterprise Solutions from the Office for People with Developmental Disabilities.
Good morning, everybody. Robert Myers from the Kelberman Center.
This is Patrick Paul from Anderson Center for Autism.
Helen Yu from the Institute for Basic Research in Developmental Disabilities, which is a part of the research part of the OPWDD.
Charles Massimo, founder of Autism Communities.
Good morning, Connie Donahue. I'm the Director of the Bureau of Early Intervention in the Department of Health.
Good morning, I'm Joanne Lacrosse, and I'm the Director of Special Education Services at the State Education Department. Good morning, I'm Joanne Lacrosse, and I'm the Director of Special Education Services at the New York State Education Department.
Good morning, I'm Bronce Perez, Intergovernmental Affairs for OPWDD.
Good morning, Jill Pettinger, Deputy Commissioner, Service Delivery with OPWDD.
Good morning, I'm Donna Bradbury, and I serve as Associate Commissioner for the Children's Division at the New York State Office of Mental Health.
Good morning, I'm Janet Sapio-Mehta with the New York State Council on Children and Families.
Good morning, Jacqueline Hayes, the Diversity and Inclusion Program Specialist at the Developmental Disabilities Planning Council.
Good morning, everyone. I'm Hira Amir, a research scientist in data management and strategy at the New York State Office for People with Developmental Disabilities.
Good morning, I'm Diane Hank, and I'm the Director of Workforce Transformation at OPWDD.
Great. Well, again, welcome to our members in the audience as well. So we're going to start today with a presentation from Greg Roberts, and looks like it's up behind me, so hopefully the people online, the one or two people online who may be watching us, can see the presentation as well, and I'll turn it over to Greg.
All right. Thank you, Chairperson Burke. We thought it would be a good idea, since we hadn't been together in a while, to let people know what things have changed in the last year, regulatorily and legislatively, regarding autism and families, individuals with autism. So I'm just going to jump right into this and try and get through quickly so we can get to the feature presentation, so to speak, today. So I broke this down into a couple of categories just for ease of understanding. These are things that passed last year, were signed into law fall of last year, and items that were passed by both houses of the legislature this year. Some have already been enacted into law, and some have not yet been delivered to the governor. So in the health and safety category, in 2018, the budget included a directive that law enforcement, firefighters, EMS officials required to receive training on appropriate recognition and response techniques for handling emergency situations involving individuals with developmental disabilities. OPWDD worked with the state police, the emergency medical services, the oversight organizations, those that work with volunteer firefighters, et cetera, throughout the state to create training materials. And so that information has now been incorporated into the training that all of our EMS people and firefighters, emergency responders are going to now be required to take in the state of New York. So the training is now up and ongoing. Legislation was signed into law that went into effect at the beginning of this year, requiring OPWDD to offer developmental disability cards for individuals who ask. This has actually caught us by a little bit of surprise at how much the demand was for this. We had done this many years ago and to discontinue the practice. Now that since we put it back in place, in the first 4 months or so, over 9,500 people have asked for these cards. They're no charge to people. They can get access to our website. You can send them in, request them, and they'll get turned around and mailed right back to you. And in this year's budget, included $30,000 for a sensory-friendly emergency room pilot program, and this is being conducted at Ellis Medicine, a hospital in Schenectady. So there are some new laws impacting service delivery for families. One, which will help inform policymakers. So, excuse me. There's an autism cost study that's due April 1st of 2021. So this new law is going to require OPWDD, the State Education Department, the Office of Mental Health, the Department of Health, and the Office of Children and Family Services to prepare a report that studies the cost for early diagnosis of autism spectrum disorder, as well as a long-term treatment of individuals, and a number of other cost estimates that are supposed to help policymakers make decisions into the future. A law went into effect that requires a Department of Health commissioner to include developmental screening for children ages 3 or younger in their best practices protocols that they put out every year for the medical community to follow. And that's to be updated every 2 years. And in this year's budget, legislation was enacted that is going to allow OPWDD, OMH, OASS, and the Department of Health to offer services under one roof. So if you go to a facility that's licensed by one of those state agencies, they're going to be allowed to offer services so that helpfully can help knock down silos and give people some holistic treatment for their needs.
Greg, sorry to interrupt. I just was wondering when that becomes effective. Is it immediate, or is it something, do you know offhand? Is that happening yet?
Yeah, this did go into effect, and right now OPWDD is creating some regulations to see how we're going to interact with the other state agencies. Some of the agencies had this prior in the budget 2 years ago. OPWDD was added last year, so we're still putting together the regulatory framework.
Okay.
Now, there are some issues designed to make it easier on families. So these next 3 pieces of legislation passed both houses of the legislature this year. They have not yet been sent to the governor, but we just want to make you aware that these could be law soon. The first one authorizes a lease break. So currently, seniors are allowed to break a rental lease without a penalty if there's a change in their disability status that would render their current housing unsuitable. So if this is signed by the governor, people with developmental disabilities will be added to this list. So, for example, if your situation changes or their family situation changes, they may need to go to an IRA or a different living situation. They can break their lease and not face any financial penalties.
So you said it has yet to be signed by the governor?
It's not yet been signed by the
So
governor.
if people had an opinion and they wanted to weigh in, there's still time?
Correct.
Okay.
You should weigh in, send a letter to the governor. And if anyone wants more information who's in the room after this, I can provide it. There's another piece of legislation that ties the ABLE limits to the federal tax code. ABLE is the New York Achieving Better Life Experience program. This allows families to set aside money for children for their future cost, or other family members that have autism and other developmental disabilities. The money can gain and will be tax-free. So this legislation would tie the New York limits to the federal tax code. So every time the federal law changes, New York's law will change in accordance. So this saves us the time of passing a law to keep up with it, and people might miss out on a year of the enhanced savings. So this will make it go into effect quicker. There's another piece of legislation impacting the ABLE program, and this, if signed by the governor, it would allow the ABLE savings to not be considered if somebody has economic difficulties and they're requiring public assistance. So, for example, under current law, someone who may lose their job or fall in hard times may be required to deplete the money that's in their ABLE savings account before they could qualify for public assistance. So this would ensure that any ABLE funds are not counted towards their wealth, so they don't have to deplete it, so they can get back on their feet and get on a sound financial footing without harming the financial future of their loved one.
Excuse me, Greg, so does that mean not only just from what they can accumulate? Not only from what they can accumulate, but also what they can take as distributions is exempt?
I can follow up on that. My understanding is it's what they can accumulate, but I'll follow up on the exemption part. It's a good question. So also in this year's budget, the governor unilaterally, through executive decision, expanded Medicaid coverage for individuals who are so that they can get ABA services. So this is expected to impact 4,000 children, and believe the investment from New York State is going to be about $26 million a year in order to provide these services. This essentially will make a consistent service for individuals on Medicaid as well as individuals that have this required under the current insurance regulations. So it levels the playing field between those with private insurance and those who rely on Medicaid.
Just, Greg, when does that go into effect?
It's already in effect. It was April 1st with the signature of the budget. I'm not sure if they're still putting in regulations, but
yeah, there's nothing out right now, so.
Okay. Yep. Another piece of legislation hasn't yet been sent to the governor. This would require OPWDD to post information on the website on how to access services. We have it on there now. We've been hearing concerns from families that it's not very accessible or easy to find, so we hope to make it more prominent, make it easier, also with some flow charts. And the next one I want to touch on, this is Chapter 227 of the laws of 2018. This impacts this board. This legislation expands the duties of this committee, and it's number 4 on the list. So 1 through 3 are what you were charged with last year, and going forth, the Autism Board is also going to be required to identify strategies, methods of improving outreach and coordination of services associated with autism spectrum disorders for minority group members, including but not limited to African American, Latino, and Asian children. And so since this is a new task of the board, I believe we're going to spend some more time on that coming up very soon. And if anyone has any questions, I can answer them now. I can also follow up afterwards. And if anyone watching on the internet has any questions, you can contact me through OPWDD. My email is Gregory, Gregory, .f, as in Frank, .roberts, ROBERTS, at opwdd.ny.gov. Or if you send in a question on the Autism Board link, I can respond to that as well. Thank you.
Hi, Greg. I have a question. Will you have this presentation available on your website? I was trying to write down all the notes, but it would be helpful.
Yes, I believe we will post this on the website.
Okay. And when will that be posted? I can email it to you. Perfect. Okay.
Okay,
Thank you very much.
We'll have it posted within a couple of days, and the members will get it emailed to them at the conclusion of the meeting.
Greg, I'm just wondering from your perspective, the work of this group, some of these things touch on issues that we've talked about here. Do you think that we've had some impact on the conversations that have been happening? Has our report been helpful? Because it was good timing in terms of being issued in May before the legislative session was over. I don't know if you feel comfortable talking about that here, but do you think it helped with conversations with the legislature?
I think it has. The legislators are interested in what the board is doing and what things that they're working on. I know we got a lot of pressure for them to kind of speed it up and get the report out there as it was being vetted at the end. So hopefully this report will help inform them for next session going forward. And it's my understanding that the board, you want to expand on the report every year, build on it, so it's going to be more of a living, breathing document. So we're not going to lose anything that was happening in the past. It's going to be added to and continued to go forward. So they're interested, especially as it grows.
Good. Any other questions for Greg? Okay. All right. I know we need a second to switch to the next PowerPoint, which is going to be a presentation on our work on reaching underserved populations by Diane Hank. So.
All right, that was quick. Thank you, Josie. So good morning again, everybody. My name is Diane Hank. I'm the Director of Workforce Transformation at OPWDD. Within the scope of my work there, diversity and inclusion is included, and that's a real honor for me to be serving in the capacity of Chief Diversity Officer and to help coordinate our agency's efforts internally as well as work externally with some of the great partners that are in the room today that are working with us. Today, my presentation will be shared by two of my most favorite colleagues in this endeavor. One is Dr. Hira Mir, who's to my right and has worked with me for some time on all issues related to diversity and inclusion, and also Dr. Jackie Hayes, who is further to my right from the Developmental Disabilities Planning Council. And you'll hear a number of times throughout this presentation that partnership with the DDPC has really been phenomenal. It's helped us to mobilize and do things that would not have been possible, perhaps even thought of otherwise. So this morning, we'll zip through our presentation. We'll ask you to save your questions to the end, but we do have time built in so that you can ask about what we're going to talk about. It's a little awkward because it's behind me, but I'm going to face you. If I'm on the wrong slide here, you got to tell me. Okay, so I'm not turning my back to you. So what are we going to do today? We're going to give you an overview of something called the New York State Community of Practice on Cultural and Linguistic Competence. And we'll refer to that as CLC a number of times going through this because it's easier to say. And we're going to give you updates on the work of that community of practice. We're going to tell you about some of the ideas and strategies that we've begun to assemble and begun to implement. And that will be hopefully a platform from which you can also offer us more ideas and strategies going forward. And we're going to touch on the role of value-based care in supporting our system to be more culturally competent, because as we move forward in our service system to people with developmental disabilities, we know that value of those services, the outcomes, the data that's associated with that is all very, very important, and without cultural competency, it will not happen. It's very strange. Okay, sorry, that turnaround. Maybe I can do it this way. So bear with me as I try to turn two ways. This is sort of a story. I'll begin with going back to 2017. The Developmental Disabilities Planning Council approached OPWDD and a number of other partners around the state with an opportunity that has been invaluable. We were given the opportunity to join in a 10-state community of practice on cultural and linguistic competence that was being spearheaded by Georgetown University. They are phenomenal. So what you see on the screen is a letter voicing our commitment. Then under Acting Commissioner Carrie Delaney and Acting Executive Deputy Commissioner Helene DeSanto, we pledged our commitment for a 5-year community of practice participation where we would partner with those that you'll hear about in a moment to say, yes, this is important to us, this is important to the people we support, and we are going to endeavor to do more and to look at the issues related to cultural and linguistic competence. So now I'm going to hand it to Jackie. We're going to go back and forth quite a bit to have her tell you more about that.
Great. Thank you very much, Diane. So I also wanted to just start by giving like 2 seconds on who the Developmental Disabilities Planning Council is. I'm not sure if folks on the Autism Board know, but also for those who are tuning in remotely, the Developmental Disabilities Planning Council is a small state agency. We are 100% federally funded, and we carry out most of our mission through grant work. I was brought on because leadership at our agency really saw the need and the value of infusing cultural and linguistic competency through all the work that we do. And so I was hired on as a diversity inclusion program specialist. And as Diane mentioned, we saw this opportunity on the national level to apply, to Georgetown's National Center for Cultural Competence to pull together a team and really start to do collaborative work around cultural and linguistic competence. So New York is one of 9 other states. We were competitively selected, so we had to pull together an application. And what is really kind of amazing about this is that it puts us in conversation with other states across the country in kind of looking at what are some best practices, what are they doing that that is working, what are some challenges that have been shared. And so that has really been phenomenal. And again, as Diane said, really this is being led by Georgetown. And so what Georgetown provides to us is they provide hands-on technical assistance. Every year we go to DC for a close to week-long forum where we really get that, more intensive technical assistance around cultural and linguistic competency. And then we also get the opportunity to hear from other states and what they're doing. And we'll talk a little bit about, we have another slide that highlights some of the best practices in other states, but I'll save that till then. And again, we're in year 2 of a 5-year project. So I want to talk a little bit about the other organizations and agencies that are part of this collaboration. So we submitted our application in partnership with 8 organizations and agencies total. So it was the DDPC, OPWDD. We also have, as part of the partnership, the 3 university centers of excellence in developmental disabilities in our state. Those are federally designated university centers of excellence. They're located in Rochester, Westchester, and the Bronx. We also have Disability Rights New York. That is the federally designated Protection and Advocacy Association in our state, and 2 multicultural agencies. We thought it was incredibly important to make sure that we had reps from multicultural agencies representing the populations that we wanted to do a better job at reaching and serving. And so Ibero-American Action League, which is a multicultural agency located in Rochester, New York, that serves mostly Spanish-speaking individuals and families, and then the Chinese American Planning Council, which has a number of offices around Queens and in New York City and serves the Chinese American community in the New York City region. And so we thought that was incredibly important to make sure that they were part of our team. Okay. So when we submitted the application, we also had to submit, a mission and a vision for the work that we wanted to do, and we thought it was incredibly important that we do this work on multiple levels. So starting with individuals and families, we needed to have a goal focused on better engagement of individuals and families, and we really will go into it a little bit more why we selected the communities that we selected. But we focused on Spanish speakers in the Chinese American community, the top 2 LEP populations in New York State as the communities of focus. And so, our first goal was around more engagement and increasing the awareness of the community, of the disability service delivery system, of our network, and their rights. And so that was, at the level of individuals and families. The second level that we thought was really important was we needed to increase the capacity, the cultural and linguistic competency capacity of every single organization that was part of, that is part of the community of practice. So internal work that needed to be done for us to do a better job at serving the communities that we had identified. And so just as one example, and I know OPWDD is going to go into way more depth on all the internal work that they've done as part of this community practice. At our agency, at the Developmental Disabilities Planning Council, we developed a language access plan, basically in alliance with the executive order. We started a cultural and linguistic competency work group. We really focused on increasing the diversity of our council. So those are a number of things that we did kind of internally. And then the other really important level is the systemic piece to make sure that the developmental disability service system is more adept and has an increased capacity to serve this community. So now I'm going to turn it over to Hira, who's going to go a little bit more into some of the other collaborations that have come out of this.
Hello, everyone. I'm Hira from OPWDD, and I've been the main representative for OPWDD as part of the Community of Practice on Cultural Linguistic Competence. since 2017 when we started this work, Jackie mentioned that it started off with 8 organizations, but since then, several other entities have reached out to me, to Jackie, to OPW, DDPC, as they heard that we were working on cultural linguistic competence and holding community forums and focus groups and doing some research around this area. So this is just a summary slide of the different entities with whom we've worked. We've worked with the University at Albany. We've done summits there on equity and transitioning from K through 12 services into OPWDD services. So they've reached out to us on this issue. We've worked with CCOs and done forums with CCOs. Those are the care coordination organizations that provide care management services. There's a number of other state agencies. We've collaborated with Access VR. So there's a number of entities, not just the 8 that Jackie mentioned, but a number of entities across New York State, plus other states that we've been in conversation with. So this work has really expanded in the 2 years that we've been starting it. So this is just a summary, a cool color-coded slide for you to see. And so I want to go into a little bit about the data that we use to justify the focus of our community of practice. The focus of our community of practice for the first 5 years is Chinese-speaking and Spanish-speaking New Yorkers. And so the data that we use to justify that comes from the census, the 2015 census, the American Community Survey. And so we usually hear New York is very diverse, and so this tells us really what are we talking about when we talk about ethnic, racial diversity. And so if you take a look at some of the boxed percentages, it really adds up to 43%. So you can say that around 40% of New Yorkers identify as Black or African American, American Indian or Indigenous, Native Hawaiian, other Pacific Islander, and then Hispanic or Latino. And if you also take a look at the percentage of people who identify as white, that's a little overinflated because you can identify as white and Latino, and that's how the census categorizes that. But if we're really talking about diversity, diversity is not just race or ethnicity. Diversity really encompasses a lot of identities. And so I just listed some of them there. So ethnicity, education, your class, your location, your educational background, your immigrant status, your generational status, all those things come into play when you're talking about cultural competency. And so that really is some of the framework that we're using when we're trying to outreach and really effectively engage and truly engage our population. So we'll be following along some of those themes throughout this presentation. This is a map that shows the percentage of people who identify as having limited English proficiency. So the red states means that more than 2 million people in that state have limited English proficiency. And so New York actually is the 3rd highest state in terms of number of people who identify as having limited English proficiency. And so 2.5 million people in New York identify in that way. And the number 1 commonly spoken language after English is Spanish. And then number 2 after Spanish is Chinese. And so that's why we focused on, for the first 5 years of this work, specifically on Spanish-speaking and Chinese-speaking New Yorkers. And so Jackie will go into the beginning of our work in the community of practice, which started off with focus groups and community forums.
Thank you very much. And so we really wanted to start with this approach because the technical assistance that we got from Georgetown really emphasized the need to go to communities and ask for them to identify their needs, their barriers, their challenges, and not kind of assume that we're the experts and that we know best. And that really doesn't set a foundation for building a good relationship. And so we decided to do, focus groups and a needs assessment as really a way not only to get data, because there is limited data at the intersection of disability, race, ethnicity, and language. So we had challenges first with coming up with data. So this is a way for us to get a little bit more data. It was a way to engage communities directly in this work. It was a way for us to start to build relationships and really, a collaborative relationship from the start of this, and to make sure that we were on point with the needs that we were identifying and the work that we wanted to do and the activities that we wanted to do as part of this community of practice. So Georgetown was really instrumental in helping us to kind of identify the value of how, the values of how we were going to do this work. So we conducted 5 focus groups over a 6-month period. Almost every member of the community of practice held a focus group and coordinated one. We also participated in 2 large forums that we're going to talk about a little bit later, and that's the data that really fed into the needs assessment. And so we conducted those focus groups in English, Spanish, Mandarin with bilingual facilitators and interpreters, and then we analyzed the notes that we got from that, and that really led to identifying 3 primary needs. And so what we heard from participants from the focus groups, but also the forums that we'll talk about, was the need for more engagement of limited English proficiency communities. And as just one example, one of the focus groups, I remember this was before, but we kind of asked if it was a Chinese American community focus group, we asked if people felt discriminated against. And they said, we don't feel discrimination like I don't get services because I'm an immigrant. I feel discrimination by neglect. People don't come here, people don't talk to us. And so that really pointed to the need for more engagement and for more outreach and more relationship building with the communities that we identified. Number 2, the need for more 101 informational resources. So really people said, the service delivery system is confusing, it's hard to know where to start, it's hard to know where to go. I want something that's at a basic level in plain language and in my native language that will help me to navigate the service delivery system and resources that are available to me. And I think kind of as part of that, it's also making sure those informational resources are getting to the communities. So a lot of people mentioned in focus groups that they heard about services or resources through informal avenues, not through formal ones. They heard about it from other parents, from other family members in their community, but not really, they didn't come across these information and resources where they were. So they kind of added some recommendations about schools, churches, community centers that they frequent, the neighborhoods that they go to, and that they live in, informational resources being available there. So that was really important. And then across the board, they really pointed to the need to address language access barriers. So one woman who shared a story at one of the forums talked about how it took her 6 years to navigate the service delivery system because of her language and get services. And, she talked about having to go back to offices multiple times because interpreters weren't provided, documents weren't translated, and that just happening kind of across the board from schools, hospitals, the service delivery system. Kind of at every turn, there was an issue around language access, and it really speaks to the need to address this on a wider and more systemic level. Okay. So I know here is going to go into this a little bit more, the forms of the family. I'll just provide a little bit of background. So as we started to engage and build more relationships with these communities, one of our council members actually brought to our attention, she's from the Chinese American community, and she said, OPWDD is holding these forums across the state, and these forums aren't accessible to some of the Chinese American parents that I work with. And so OPWDD made the decision, I think with a lot of help from Diane Hank, to have the commissioner go down to University Settlement, a community center within the Chinese American community, and 200 Chinese American parents came out to this forum. We also had a team from DDPC. Sheila Carey, our executive director, joined one of these forums as well. A number of state agency representatives came and really were able to hear firsthand directly from the community what were some of the needs and challenges. And so we thought it was important because this was a forum that was organized in partnership, but a number of Chinese American community organizations, they were the ones that kind of advertised and got 200 people to this forum. So we incorporated the needs that they identified into our needs assessment because we thought it was so important since it was coming directly from them. So I'm going to pass it off to here if you want to add anything.
So just to give you a sense of what it was like in the room, and this was a very eye-opening experience for me, and I think for the rest of the staff at OPWDD, when Diane had asked with an interpreter, how many of you speak little to no English or have trouble understanding English, it seemed like 80% of the room raised their hand. And so that can really give you a sense of, if you think about the way that we talk in government and in services, the way that we write our documents, when we go out and present even this presentation, if someone raises their hand because they don't speak any English or speak very little English, you can imagine the language barrier and the gap that is there. It's there, right now, and it's also there in our written document. So that was really eye-opening for me to see that it was just incredible that 80% of the people there have such a huge language barrier. It really changes the way that you present, the way that you talk, the way that you share, the way that you write information. And so that really, at the individuals and family level, there's a lot of work that needs to be done there. These are just some really important quotes that we heard from parents and what they submitted in an assessment that the community submitted to us. A parent had said that, I do speak some English, but I do not thoroughly understand the complicated system of OPWDD. I'm feeling overwhelmed and extremely worried about losing services. And so there was a lot of fear there. And this is a direct quote from a family member in the room. Another quote from, actually, this was a focus group that we did with the Korean American community. Parents were worried about CCOs not offering them services. And so this quote is saying that the MSCs originally in Long Island did not have language services and that they were being turned away from these services. And so a lot of concerns were coming up in the community forums that we were doing around care coordination. Namely, parents were concerned about the cultural competence of their direct support professionals and their care managers and their Medicaid service coordinators. So that came up a lot. So the cultural competency of the workforce was coming up. And parents, there were a range of people who understood the system and those who were new to the system. So in one focus group, people were really interested in self-direction but didn't have a self-direction liaison who understood their language. So you had people ranging from not even knowing what OPWDD is to being really familiar with OPWDD services but experiencing a barrier. So these are the things that we were uncovering in our focus groups and in our community forums. Did I leave anything out from that?
Okay, passing back to me. Now, just to give you a sense of place, when we started off in the beginning, we told you that we were going to give you an overview and some updates on the CLC, and we're moving out of that, and now we're going to shift into the ideas and strategies that we've tried to implement and come up with. And you will also know, if you think back on the earlier slides, that we said that the scope of the community of practice has 3 levels: individuals and families, internal to each of our systems internally, and systemic. So now I'm going to talk a little bit about the individuals and families. As Hira and Jackie shared, that forum with the Chinese-speaking parents was really informative and daunting because the need was so tremendous and the challenge seemed so great, and it was overwhelming because we thought, well, where do you begin? We took the first step, which is talk to people. That's where you begin. You begin by talking to people and finding a way to do it in a language that they understand. But just like I'm speaking with you this morning, I was standing before about 200 people and knowing that my PowerPoint and everything that I had prepared to say was going to have to be moved through an interpreter, and the jargon that I use, I apologize for that, but to some degree, we all do it. So it was very eye-opening and really gave me pause and has helped us think through how do we approach these challenges. All right, so what are we doing in terms of making changes and innovation for individuals and families? Remember that our goal is initially from the community of practice to focus on Chinese and Spanish-speaking communities. However, one of the focus groups that was done with the Bengali community, and we had a great forum with the Korean-speaking families. So it's not exclusive. We'll go where we can, but those are the 2 areas within our initial vision statement. So let's go back a little bit. Language access is not something new to New York State. Governor Cuomo in 2011 issued Executive Order 26, basically saying that, acknowledging that there were 2.5 million New Yorkers who have limited English proficiency and directing all agencies to address that. And OPWDD has done that. We had to try to work to remove barriers. So back one. We were directed and we began to translate vital documents, provide interpretation services upon request, develop a language access plan, as all agencies were directed to do, of how we were going to approach this issue, have a language access coordinator, someone on staff who actually focuses on this issue for us as an agency, and then the last one is about the deputy secretary. So do we have information on our website? Yes, we do. Is this enough? No, it's not. It's a start. It shows good faith. It shows that we're working. And the next slide I'm going to show you is some of the initial data. So each year we roll up data, which is an incredibly important focus for everything we're doing, is to try to drill down and find whatever data points we can so that we can measure outcomes and success, hopefully. But you'll see if you look at this chart that in the time period aligned at the top from 17 to 18, we had more than 2,000 requests for telephone interpretation that we filled. We did fill requests for in-person interpreters of more than 100. You can see what our top 3 languages were. You can see how many documents were translated by the vendor that we had contracted with, 485. And you'll see a list of some of the documents that we had translated. So all very important, and it's a start. And if you look at those numbers, you might think, well, gee, that's pretty good. And I'm not saying that it's not. It is good. However, I learned something at the Chinese-speaking forum about interpretation. I said to them, we have language access. If you call one of our offices, all you need to say is, I need an interpreter. And what the folks told me there, the feedback from the room was, well, in our culture, if the person who answers the phone is not speaking Chinese, we're going to hang up. We feel unsure, it's intimidating, we're just going to hang up. And so I thought, well, there's an educational campaign that we could do, just encouraging that community. Please don't hang up, because someone in our office has been trained on language access and should be able to help. But those are the kinds of bridges that we need to build and that we would not have learned about if not for that day. So what are some of the things that we have done based on these bits of information and these interactions? Well, one of the things that OPWDD did is we changed our vendor for translation services, because we found out in talking to some members from different communities that our translation service was not accurate in some of the areas in which it needed to be. It wasn't completely wrong, but the vendor didn't really have an understanding of the developmental disability system, so some words might be translated not quite right, and it was problematic. We had family members say to us, just give us the documents in English. We will translate them for you for nothing. We said, no, you don't have to do that, but we would like you to look at them and tell us if the translation is effective. Other things that we've done, obviously we're collaborating with the DDPC, and a newer collaboration is with the Office for New Americans. I'm not going to go into what that is. You really should learn more about it. It's a phenomenal new office, new division within the state of New York. They're doing really good work. So we're trying to build a bridge there on information to them, because they're out in communities, reaching people in all parts of New York State. It's a great system. One of the other things that's come out of some of the initial work we've done is that our regional office in New York City, Mary Grace Giuliano, who is an awesome director of Region 4 in our regional offices, has begun having quarterly meetings with the Chinese-speaking community, because they've asked and they wanted increased communication. And really it's just people talking to people and getting our regional offices tuned into them so we can understand what's the need and how can we help you. All of our strategies are based on collaboration. And I have to say that even the collaboration you see within this presentation, the collaboration we are now seeking with you, got to say I'm so enthused. I was thrilled at this invitation to know that your work is now aligning with our work, and we can somehow share and hopefully partner together going forward. So building relationships, talking to people, collaborating is really central to everything that this initiative is about when it comes to diversity and inclusion. So I'm going to let Jackie talk a little bit about what Georgetown has taught us related to those issues.
Yeah, so one of the things which I think is really important is just the value of building relationships with communities first. And a lot of times from like an agency or organizational perspective, if you say, I'm going to spend a year of my time building a relationship, that might be something that doesn't translate to something that's seen as valuable, but that is, from Georgetown, it was really, important, and they stressed that that step needs to happen first. Otherwise, no other steps are possible. If you don't build trust with a community and identify some of the leaders in that community, the trusted leaders, and build those partnerships and build that foundation, really no other activity is going to be possible or successful. And so I think, that is a little bit of a shift of approach and a shift in thinking of maybe how we've done things in the past. And I think, too, some of the, things where there might be miscommunications or breakdowns, if you have trust at the foundation, community members will call and reach out to you and ask for clarification or details, and that's already started to kind of happen, where we will have members of the community that reach out and say, I got this information, is this correct, or this kind of breakdown is happening. And that initial relationship was just so instrumental and important and valuable in making sure that things are resolved quickly, and that things, if there's some sort of issue, that it doesn't snowball, that it can be resolved immediately.
Shifting from individuals and families in the focus, now we're moving to the internal. Each of the members of the community of practice, including OPWDD, has made a commitment to look at its internal structures and practices and find ways to be more culturally and linguistically competent. So, a year ago, Governor Cuomo issued Executive Order 187 that is designed to ensure that diversity and inclusion and combating harassment and discrimination in the workplace are a focus of all state agencies. A new office was created, the Office of Diversity Management within the Department of Civil Service. And while this executive order, as you read through it, is primarily directed at state agencies and the New York State workforce, for us, it is a perfect parallel to the work that's already begun in the community of practice. So I was very pleased to see this come alongside. So now this helps us work on our internal commitment to be inclusive and to be respectful of diverse populations. We're only 1 year into the executive order, and by the end of this year, we'll have our strategic plan as an agency developed and submitted. But here are some of the actions that we've undertaken at OPWDD to begin this process. We've begun and we just undertook a self-assessment survey to gauge where we are on some of the major issues related to diversity, inclusion, and a harassment-free work environment. We're doing a data dive. We are looking at every data point that we can find to help us illustrate how we're reaching people in New York State, who we're reaching in New York State, our workforce, the demographics, and some of the other differences within our workforce, so that we can get a starting point to see where we are, and that way we'll be able to measure going forward. We've also begun a coordination project with our regional offices. They do a lot of work reaching to different communities, but we weren't tracking any of it. So we have a meeting with them on Monday to talk about that very tracking, to see if we can add to the narrative. That's not going to be as data focused as some of the other things we're doing, because it's people talking to people. It's critically important that we begin to start to capture who we talking to and what collaboration can we do so that we can talk to more people and share information. And also, as I mentioned, the partnership with the Office for New Americans. We also had a meeting with them and all of their regional coordinators about 2 weeks ago, between our regional office and all their coordinators who are out in the field around the state. Basically, we walked them through the front door process. We educated them on our service system. And we said, we will continue to work with you and provide you with any materials you need. Please give us feedback so we can build a relationship with you, because if you're out in places where OPW is not, we can learn from you, we can help you, and there are people who probably need services and information, and they can help us do that.
So that was the internal piece, and now we're moving on to what we have in place system-wide to really help make sure that cultural linguistic competence is systemically built into the OPWDD disability services system. So I'll present very quickly just 3 regulations that we have in place that have been really effective, or that have been really amazing. I'm proud that we have this in place in New York State. I'm proud to be part of New York State, where cultural linguistic competence is not just being done at the individuals and families level or internally, but also system-wide. As I mentioned earlier, families and people with disabilities at those forums and focus groups are really concerned with the cultural competence of the workforce. And so what OPWDD has in place is skill building areas. We have 10 skill building areas for care managers. So care managers have to be trained in these 10 areas. Area number 4 is actually cultural competence. And so we work with the New York Alliance for Emerging and Multicultural Providers to come up with this skill building area and come up with a number of learning objectives that need to be met by every care manager that is hired and trained by a care coordination organization. There's examples of those up on the screen, but just to tell you, one of the areas in which they have to be trained, care managers have to be trained, is a learning objective that says that you have to be able to advocate for the people you support and the families in a way that respects group and individual differences. You have to understand their cultural background. It states a bunch of different theories that you can use, a lot of resources, open source resources that CCOs can use to train their care managers to be more culturally and linguistically competent. So this is a skill building area and a regulation put in place or guidance put in place by OPWDD, but it actually comes from the Department of Health. So the Department of Health has cultural and linguistic competence guidance for their health homes. So it's not just at the OPWDD level. This guidance also exists at the Department of Health level and exists for all healthcare professionals across the healthcare system. In addition to that, some of you might know that we're preparing for a transition to managed care. In managed care, we will be forming these healthcare entities called CIPPLs, and CIPPLs also have to be held to Department of Health standards. And so the standard that you see on the screen comes from the Department of Health guidance, and there is one specific guidance that says that CIPPLs in the DD system have to make sure that there is representation on their advisory committees. And so that really is important, because at any level of your agency or in the system where there is a committee like this one that really is supposed to gauge and respond to the needs of the community, there needs to be members of the community sitting on that board. And we have that guidance in place for the CCOs, for the CIPPLs. And Jackie had mentioned that that's something that the DDPC has also invested in. And I think that's also a goal for the Autism Board. In addition, there's a number of other requirements for CIPPLs that have to do with accessibility of information. So when you post on your website, when you post a provider directory, and people with receiving services can choose their providers, that directory has to be translated in other languages. It has to be translated in the language of the people that you're serving and the people trying to access services. So these are very well stated in Department of Health regulations, and OPWDD is adopting these regulations for our CIPPL. So there's a lot in place for accessibility and cultural linguistic competence. The DOH's model contract also has an entire section, actually, section 15, about cultural linguistic competence. So health management organizations and CIPPLs in the DD system have to have a cultural and linguistic competence plan. They can conduct internal assessments, just the way that OPW and some of the state agencies have done. And I just put a screenshot there to show the evidence, but these regulations or these guidelines are there, and OPWDD is adopting them. To make sure that cultural and linguistic competence and investment in that is not just coming from the community level, but is also coming from the top. We've also learned what cultural and linguistic competence looks like from other states, and potentially what a system that is dedicated to cultural and linguistic competence can look like. And so Jackie's really been the liaison to other states, so I'll let you explain this one.
Yeah, so again, we're, as part of the community of practice, we get to hear and be in touch with, 9 other states and territories. And so just to highlight a few examples from other states that we thought were really good and promising practices. So one example, Wisconsin has built cultural and linguistic competency measures into their managed care and data organization contracts. So actually having, accountability measures in the contracts that really speak to and make sure that organizations do have that embedded into the work that they do. In California, at the state level, the state has actually allocated a few $1 million to focus on grants and initiatives around targeted disparities within the community of developmental disabilities. So they have a number of projects and initiatives that are about eliminating racial, ethnic, linguistic disparities among people with developmental disabilities, and that was really neat to see some of the projects that they funded. The other kind of piece which we've seen, not necessarily from other states, but from the way other systems have been built to be more responsive, is really using data as a way to understand and respond to communities. And one very specific example of this is, let's say in a region of the state, if you use that regional data to see what are the top languages in this region, because it varies in New York. You know, in New York City or in Queens, the top language might look different than in Rochester or Buffalo. And so using that data as a way to think about, well, maybe in Rochester it's Spanish, and so that means we need to hire frontline staff or ensure that all our documents are in Spanish. Maybe in Queens it's Chinese and Mandarin, and so that would be a data-driven way to look at regions of the state and really have that drive how you respond to communities.
I think we have a few minutes left, so I'll skip over some of this, but I'll answer questions if you have any, of course. So as we transition to managed care, we often talk about the triple aim or the quadruple aim of managed care, which is really about patient satisfaction, health, home outcomes. And at the Community of Practice, we've been having conversation and looking up research and interventions that show that actually a culturally and linguistic competency approach is what can help achieve satisfaction of the people we serve and also the health outcomes that we want for the people we serve. And so that's the framework that we're using under the managed care system. So I'll go into that a little bit. Have any of you heard of social determinants of health? So the social determinants of health framework is inherently a culturally and linguistically competent framework, or it is, I think they're one and the same, maybe they're parallel, maybe they're perpendicular, but we're talking about the same things. So in the community forums and the focus groups that we've mentioned, the communities are telling us essentially what are those social determinants of health that either help or hinder them in living a quality lifestyle or accessing services. So I just circled some of the examples. The most obvious one is language and literacy. So language and literacy is a social determinant of health. And as Jackie mentioned, families have said that it's the limited English proficiency presented a barrier in receiving services. And for some families, it took up to 6 years, 5 years to get services. And so that's just one example of a social determinant of health, language and literacy. There's a lot about early intervention. Parents have said that they wish that they knew about OPWDD services sooner, that they kind of were lost in the K-12 system, or they depended on the school, but when their child turned into an adult, they really didn't know where to go, and they wish that they had known about OPWDD services earlier. Health literacy is there, your educational background. A lot of the parents, due to a language barrier or just not having familiarity with the healthcare system, experience a barrier there. So we're really learning about those social determinants of health, and cultural linguistic competence is maybe just an approach or an avenue or a way to do that. These are just some examples of interventions that have existed actually outside the DD system, sponsored by the Department of Health, that I think are culturally or based on cultural and linguistic competence. So people who are aging, people with disabilities often don't have access to food, or they can't physically go to the store. So other hospitals and other healthcare entities have partnered with community-based organizations to do food insecurity training or food security training, but they go to where the populations are, they go to where the trust is. Instead of doing it in a medical center, they'll do it in a library or a community center. And so those are just examples of things that we've been talking about, but that actually is an intervention that can help improve health outcomes. Another one that I really like is the hospital discharge cohort program, where nurses started learning about their patients and realized that people living in poverty are not making their appointments. And so what can we do to make sure that they attend their appointments? And found out that it really is about access, about public transportation, and being able to make it to your appointment. So nurses have started in this one program to provide transportation and to help people help uplift some of those barriers that are preventing them from coming to their appointment. And so that, again, is that social determinant of health, cultural linguistic competence knowledge that is helping healthcare organizations intervene. And this one I learned about recently, which had to do with the electronic health record system, where doctors were given the option to print out health records in other languages. And they were able to find an actual statistical correlation with the number of prints to people achieving good blood pressure levels. And so it's such an easy thing, printing out medical records in another language, and found that that group that had that intervention actually was able to reduce their blood pressure in their patients. So these are just some ideas that are existing out there where healthcare entities are learning about their populations, about their patients and their populations through a cultural linguistic competence, social determinants of health framework, and just really being effective in how they're learning about the people they support. And so this is a quote by Nancy Copperman, who's the vice president at Northwell Health, and she said that there can't be health equity without social equity. And I think that really is the biggest takeaway here, and what we're talking about as we learn from communities and about communities is how do we achieve social equity, how do we learn about those social determinants of health, and how do we become more culturally and linguistically competent. So this quote, I think, helps to really summarize what we mean when we're trying, what is the goal of cultural linguistic competence in our system. Another thing that Jackie and both Diane and Jackie emphasized is that none of this is possible without collaboration with community-based organizations. Community-based organizations are the experts, the people that they serve, the people that they represent, they're the experts, not the government agencies or the health management organizations in this area. It really needs to be a collaboration with government entities, the health organizations, the community-based organizations, and the providers. And so I just wanted to re-emphasize that toward the end. So that's my part.
All right, thanks, Kara. Oops, back one. All right, so next steps should be fairly obvious based on what we talked about. We're going to continue doing what we're doing, trying to do more, trying to establish more effective partnerships. And I want to thank Hira and Jackie for being incredible leaders in this initiative, because it's nothing that can be done alone. And I want to invite all of you to share your ideas and your partnership in this issue, because it's overwhelming but critically important now and in the future. So we're happy to field questions if you have any, and beyond that, thanks so much for all your attention. We threw a lot at you, but you can tell we really like what we're doing here, so thank you.
I was going to make a comment and ask a question, and then I want to see if anybody else has any comments or questions. Actually, it's a couple comments, but really impressive how collaborative the work has been, not just among the agencies in the state, but across states, and learning from each other, so you're not reinventing the wheel, so that's really nice to hear. And very comprehensive research that you did with the different groups that you spoke about, and I love the anecdotes that you provided, so congratulations on that. Also think it's really good that you're incorporating what you've learned into what the SIP PLs are going to have to do if that's where the delivery system is headed, and then also looking outside the developmental disability world of what's happening in healthcare and making sure that you said parallel or perpendicular or whatever it might be, but that you're learning from each other. So I found the presentation on what you guys are doing impressive. And I think really my question is the needs that were identified specifically at one of your sessions, or maybe it was multiple sessions, which was on one of your slides. There was 3 specific needs, and you sort of touched on some things that you're doing in each one of them, but I was wondering if you could expand on them. The 3 needs were, first, the need for more engagement of communities with limited English proficiency. You did some of that, but how are you going to make that ongoing? Then there was the need for more 101 informational resources. Have you been able to begin to develop those, or do those exist? And then third was need to address language access barriers. And so since those were the top 3, I was wondering if you might specifically address them.
Okay, yes. So the top one, could you, just because I have a brain that things come and they go, more engagement of the communities. So that's the reason we're focusing on working with our regional offices more deliberately about, well, what are you doing out there? Because it's not to say that all of the people who receive supports aren't interacting with either OPWDD or one of our voluntary providers. But when it comes to access or services and basic information about the front door and eligibility and all those sorts of things, that is handled through our regional offices. So that's where we began. It's not where we'll end completely, but we had to start there. So that's why that dialogue has begun, and we put together a data collection vehicle, actually here, I put it together to give them, and all the directors have weighed in on what that looks like, to say, tell us who you're engaging with so we can identify the good things and then the gaps, because we know there are. So we can take that information and hopefully use it. And so we're probably 6 months in on that in terms of figuring out a system, because there's lots of offices, as you probably well know, around the state. And so every time you handle a phone call, it's not like you just put a data check somewhere. We have to collect that information somehow. We need that baseline. That's the first step on that. More 101 informational resources, yes, also working on that. I think the first step was making sure the translations we do are better. So that was our first step there, and that's why it took us some time to change our vendor to make sure that we were delivering quality. We have not taken the second step yet, but will be taking the second step of boiling it down for people. Just like when I stood in front of that group and didn't realize how much jargon I was ready to share. When you're getting down to I don't really know what the 101 level is anymore. I'm too immersed. I've been in the system for a long time now, and so it's really hard to separate that. So we need to get some focus groups together on that to help us whittle that down. So with communications help, we'll do that. Now remember, too, that we're also, our focus initially is OPWDD, but our field and our other providers, not just the CCOs, but our service delivery providers, they have to be brought in this too. And that's another area where we haven't made a big step yet. Okay, that is to come. One of the ways that will happen, at least initially, is through our regional centers for workforce transformation, which are regional collaboratives that are funded by OPWDD. And one of the new areas that we're going to be expanding into in the next 5 years of the contract is to I'm sorry, I lost my train of thought. To begin training the direct support workers to be more culturally competent, because clearly on the front lines you have to be more aware, and so we don't really have a standard training. I mean, there are trainings, but it's kind of hit or miss, so we need to work on that. So I'm getting off topic on that. Third question was, or the third area was addressing the language access barriers. That's just ongoing. I think we have our report from the focus groups that just got completed this week, right? This week. So we'll be disseminating that, getting feedback, and then we'll put together a strategy of, okay, how do we continue to make inroads? So I wish I had more definitive things to say. You'll check that box, we're done. No, we're just starting. I have to be very transparent on that. We've just started to wade in the water on that, but I believe we will get there.
Other questions or comments from anyone?
I would just say that even for English-speaking individuals, it's difficult to navigate this system. So I deal with a lot of families from New York City. Many of them speak Mandarin and Chinese and other languages, and really it's ad hoc how we sort of manage with these individuals. We try to find someone who's part of our staff who speaks language, or someone who knows someone, and we actually are able to access resources through volunteers to help us. But in no way are we providing the information that they need to make good decisions for their children.
One of the issues that's come to us is that while OPWDD is clear on its obligation to provide translation, there's some question in the field because sometimes it costs money, resources to get. So for provider organizations, their own documentation, that's come back to us a number of times of, do you have extra money for that? No, we do not, but the translation is important, so that falls back into our provider system as well. So that's a real issue.
I have a comment, and I think there's a question in here. As we think about social determinants of health and how they lead to value-based payment, and we think about how we're going to measure value, I for the last couple of years, been wrestling with this issue of we don't have any good scales on quality of life for people with intellectual and developmental disabilities, and we're kind of marching towards this notion of value-based payment. And so now I really appreciate your talk, and Tawera at Georgetown's a friend of mine, and her work is fabulous, right? So it's important that we figure out how to be culturally competent, but it's also important how we figure out what quality of life is so that we can measure value. And so I guess the question sort of would be is, in your work, have you found, are there valid and reliable scales that can measure culturally competent either outcomes at an agency level like OPWDD or on a smaller scale? I mean, how do we know we're doing this work well and validate it? And then just to kind of plant the seed that I don't really hear a lot of conversation in New York or really anywhere around what and how we're going to measure value for this population, because we may end up in a system that's just as fungible as the one we're in today. And that seems pretty likely at this point to me. I'm not an expert in long-term quality of life measure, but I'm trying to make myself one. And so, two things, right? That little question about how do you measure success in sort of either culturally competent training or knowledge dissemination, and then the sort of comment that I would be open for future conversation about how to really get towards quality of life measures that could be empirically evident, because there is a literature. It's more of an emerging literature, but something I think we need to be paying attention to.
So I'll start, and then Hira may have some things she'd like to add on this, because she works with Tamika Black, who's one of our deputy commissioners for data management and strategy, and we talk about this. How will we measure? How will we know? And so, and to my knowledge at this point, we don't have it figured out. Here are some of the conversations that I've had. So it's just my conversations with other folks as we're trying to look at this. So we do have like the Council on Quality and Leadership, those personal outcome measures. But I'm not a data person, but those are not the ones, because they're about an individual, and it's the wrong kind of measure. It's a good measure, it's good that we have those, but that's not the kind of systemic measure that we're looking at when we try to measure those outcomes. So a lot of people will point to that, and we've got those. Well, but I've learned enough from talking to colleagues to say, no, that's not going to take us where we need to go. And so we are looking further, and I'm not an expert on that, so I would recommend that for perhaps future consideration, you might ask Tamika if she would be willing to come and have a discussion about that. She'll be far more prepared and knowledgeable about that. Unless here you have in your work with her got anything right now that would shine any light on this issue. I know we're working on it, and we're trying to figure out what should that look like. How do you measure that value when it's about the person? There's some indicators we're going to be able to measure. You could even do trainings and do transfer. You can do pre and post testing and that sort of thing. So it's not to say we can't measure anything, but the real measure of the person who's receiving a service or support of some kind, and how effectively they're being supported in relation to their culture, is one I don't have the answer to at this point. Hira, do you have anything to add?
Well, just that I think what you've identified is the biggest mystery in our system, and that's what the DD system and behavioral health have to really come together to figure out what would those outcomes look like and how do you measure them. I don't think, and maybe there's someone else here who knows and can provide more information, but that's what we have to figure out in the DD system, is what those measures would look like when you're trying to measure long-term support, long-term quality of life. I don't think those are there, and we're going to really have to be the leaders and be at the forefront of this. And we're going to the DD will have to educate other health fields on that, because I don't think it exists. And that's really the biggest mystery. When I think about cultural competency, I think of it more in the intervention. So the intervention and the approach, the training can be based on cultural competency, and then that's what you would say is then what impacts satisfaction, happiness, work-life balance of your employees. And then, as a mediator, then impacts those other outcomes, those kind of tangible healthcare outcomes. So I think of cultural competency as kind of, I'm trying not to speak in research terms, but as the variables that influence the outcomes, not as the outcomes themselves. And so if you see in the electronic health record example, it was the intervention of printing things out in other languages that was then seen to have a correlation with blood pressure rates and other more tangible, concrete outcomes. So that's how I think of it in my head, and maybe in the future we'll come up with the answer to what you're asking. But from the work that I've done, I've thought of it as more of the intervention and more of the approach to achieving those outcomes.
Any other questions, comments?
So
that was a hard one.
That's the big question.
It is. I'm sorry. Go ahead.
So I'm just curious, as far as you had mentioned that at the frontline people, that's where you need a lot of assistance. And when you think about the unemployment rate of educated minorities in New York, it's very high. So I'm wondering, is there any outreach? Is there any aggressive push to let people know that these positions are needed by minorities?
I can't say on the voluntary side what they're doing to target potential workforce populations. I just don't know the answer to that. On the New York State side, I know that we're aware of the need and we want to address that need, but one of the issues, very honestly, about the civil service system and the record-keeping system is that records have to be kept in English. So if you're working as a direct support professional and you have to do documentation, Patrick is nodding his head, and I just learned about this because I thought, well, why aren't we going here and pulling these people in because we know that they will help us in this time of low unemployment. So that's another very thorny issue. If the record keeping has to be in English and you have to be able to write proficiently in English, then if you are at a limited English proficiency, that's a huge stumbling block, even if you can get through the civil service testing system on the state side.
If I could just touch on that for a second.
Please.
It's so, because we have a lot of folks who come and who are looking for employment, but that language barrier really does limit it, because it's a risk element that comes with that also. So no, we really don't hire folks who don't have an ability to speak English to a certain level.
So that's a thorny one, and one of the longer term issues, given our tremendous workforce shortage, that I think we will be forced to confront. But it's very complicated, and I'm looking at my colleague, Dr. Pettinger, like, oh boy, Jill, can't wait till we have that meeting, huh? But how would we do it? How would we do it? You know, and I don't know the answer to that, but we do know, I mean, you folks have probably well-versed in the demographic information about the increasing need for the workers that we employ and the decreasing supply. So it's getting harder and harder, and so we have to be more innovative in terms of who we can bring in. And that is just a matter of fact of we don't have enough workers. To go beyond that, we need workers who can speak in the language of those people who are receiving the services. And so it's doubly important.
Can I just touch
Sure,
on one
please
other
do.
thing? You need a certain quality employee. When I say that, we're asking a lot of our direct support professionals. So even for those who can speak English, not everyone can come and do the paperwork that's necessary or provide the interventions that are necessary in order to support the folks that we serve.
Right.
Any other comments or questions? Phenomenal report. Thank you for the presentation.
Thanks for having us.
I think the questions that came up, because now we have open discussion, help to maybe direct us a little bit about some of the things we might want to focus on in the future, but I want to open it up for other ideas. One was the idea that you brought up, Rob, related to the importance of instilling the idea of what is value, what does it mean for an individual who is on autism spectrum disorder. And then I think secondly, there's so many issues around workforce, some of which we address in the report, but some of which we maybe could look at more. Those two issues, based on the comments that were asked, come to mind as something that we might want to focus some of our work on in the future. But I wanted to open it up to members of the committee if there's, what do we do next? Where do we go from here? Your thoughts would be welcome.
Sorry, it's awkward to try to get close to this microphone. I feel like I'm on the radio. So over the last, how long have we been together? 18 months? 2 years? The persistent issue has been that although the board has tremendous experience and expertise, there is really limited capacity to follow through. And I think even going back to some of the original, I don't know what you would call them, policy assistants that helped to craft some of the original legislation, there, I think, was intent for this body to be able to follow through and provide evidence to the legislature that is evidence beyond our own opinions. And we don't, unfortunately, have the bandwidth to do that. And I understand that that's because we don't have funding. So a few of us had sort of nosed around and tried to figure out if there was money left on the table, which is something I learned about in the last 6 months. And we missed that window. And so I guess the question I have for the group is is finding even a little bit of funding so we could have maybe a research assistant and a coordinator, or combine into one FTE, a position that could be associated with the board that could help. I mean, Neil did a brilliant job supporting us, so hats off to Neil. I think he knows how much we all appreciate his work, but Neil's got a full-time job. And going forward, if we are to, provide evidenced opinion and really be able to do due diligence, I think we need some funding to have even a tiny, small staff. But at this point, I don't know how to proceed with that, and I feel a little bit at a loss.
Well, it is a tough question. And I know, Greg, you've kind of taken on some of the responsibility since Neil has switched roles. But I know you're kind of always, all the agencies are pitching in where they can. And, I know Diane, Jill, a lot of people around the table. But it's a great question. We need a strategy if we're going to get money for a position.
One thought I had is that maybe one of the provider associations could help us lobby to get some additional money in the budget or off of the said table in future budget discussion. I mean, I know that won't help us today, but I'm just trying to appreciate the position that the state agencies are in and think about how this group, and really, I mean, we should look at each other as board members on this, because I think it's up to us to try to take that work on to see if we could try to develop a little bit of a platform. I don't know. But
I wonder if there's any opportunities for grant funding that would fund a position in some related research for that. I'm just throwing out an idea here. I don't know. Grants is always the magic word. It always sounds simple, but finding them and applying. But that was my first thought.
Yes.
There are quite a few organizations in the state of New York and outside the state of New York that would probably be happy to do some grant funding, except they'd have to know what they're being asked for. So I think the first step would be to design something that would outline what the ask is.
That's a really good point. Whatever the scope or your biggest question is as a board.
Yeah, I think, if I were a funder, I'd say, well, what is this person going to be doing? What's the job description? How are they spending their days? What do you hope to achieve? So maybe that's a to-do for us to come up with that.
So the policy subcommittee created a logic model on how to make recommendations related to housing, and I think that could easily be made into a proposal. The activities associated just with that subcommittee could take, it's not a full-time FTE, but it's somebody's time, and it's considerable. I think if we look across the report, this is the beginning of a proposal, right? We could break down every one of these recommendations and spend some time familiarizing ourselves with the nuance related to these questions so that we could inform future legislation, as well as inform OPWDD and SED and OMH and other practices in New York. But at this point, I mean, these are, don't get me wrong, they're very solid recommendations, but if I were in the legislature, I wouldn't be entirely sure what to do with a really broad recommendation without some additional content that had identified maybe process and solutions, right? We're not to process and solutions yet as a board.
Well, it sounds like a logical next step as a to-do for this group is to outline what you've suggested. And then I think I would turn to our legislative experts and others who know a lot about grant funding. Who would we go to, whether it's the legislature or potential funders, once we have that ready? So, and I'd suggest that we set a time frame for ourselves that maybe by end of September we have that position description better outlined.
Just to let you know, there are a number of organizations in this. I mean, when I say the number, there's quite a few that would probably be very interested if, depending on, especially if the government is very interested in moving this forward, that collaboration would really be something that they'd be excited about. So I really don't see an issue with it, to tell you the truth. I just think we need to figure out what we're asking them for, and then ask.
And so maybe, Rob, it was your suggestion, but maybe you and I and some of the agency staff can go back and forth on
Great.
on developing that. We can take
That'd be
that
great.
on.
Thank you.
Okay. And I don't want to lose sight of the ideas for future meetings related to measuring personal outcomes and how does that fit into value and some of the issues that were brought up around workforce, so that we keep that in mind. Whoever ends up taking the notes for this meeting, I have my own, but I trust that somebody else would keep better track. Any other comments?
Just one more thing. Is it possible for us to find out about some of the innovative, creative initiatives that organizations around the state are sort of working on that we may not have another opportunity to find out about it? Because I think that may spark an idea as to something that this group could work on, to focus on, to help support in a different way.
When you say other organizations, you mean some of the provider organizations? Or?
Providers, New York State agencies, what are people doing out there to meet the need that we don't know about, that may give ideas as to how we can help to start to deal and tackle some of these issues.
Yeah, I'd be open to that. We did a review with the state agencies when we first started. That was kind of the first task that we undertook, was looking at what every agency was doing that might touch on autism issues, and made a compendium, which was really helpful. But we haven't really gone back out, nor have we specifically asked for innovation strategies.
And I don't think it's necessarily just agencies. I mean, there are a significant amount of nonprofits that are really think tanks on research for autism, and one that comes to mind is Madison House for housing, and they've been doing national studies of unique housing opportunities that people have come up with throughout the country for adults with autism, and they're probably one organization that we could look at to get some input from them.
That's great. Okay. I love that idea. So maybe we could have some of them present at our next meeting. And I don't know when that's going to be. I mean, we sort of, I'm guessing either end of the year, maybe December or something like that. That gives us time to get some of the work done in between and identify some speakers and that type of thing. So any other thoughts or comments from the group? All right, well, again, thank you all for your time today, and to our presenters, and we look forward to hopefully seeing you again towards the end of the year. Thank you.
Thank you.